Good morning, everyone. This is the Health Equity Panel, and I am Dr. Julie Morial. I'm the Chief Medical Officer for United Community and State, and I'm thrilled to have my passionate servant leader team on this call to share their wisdom and insights about how we are moving the needle in the health equity space. Let me introduce our panelists. They include Davondra Brown, who's the Director of Community Partnerships and Health Equity, Dr. Eboni Price-Haywood, the Medical Director of the Ochsner Xavier Institute for Health Equity and Research, Dr. Eric Griggs, who's our Health Equity Ambassador for the state of Louisiana, and Dr. Alma Stewart, who's the lead at the Louisiana Center for Health Equity. Thank you all, servant leaders, for joining the discussion today. And let's get started. We are now 2 years into the COVID global pandemic. As a country and state, we've become acutely aware of racial disparities in health outcomes and witnessed across the board a greater commitment to health equity. We all know that achieving health equity requires a multifaceted approach, and we have to address health holistically. We're going to ask this panel to explore what it will take to make health equity a reality and consider what strong health equity infrastructure looks like. Let's start with Dr. Brown. Dr. Brown, we'd like to hear about what's happening at the state. Has the experience of COVID-19 shifted the way we think about holistic health and health equity at the Louisiana state level?
Sure. Well, thank you so much, Dr. Morial. And just one correction, I'm not quite doctor yet. I did do my comprehensive exams yesterday, though, so I'm well on my way. So I'm excited about that. But I thank you so much for having LDH here today and to discuss and to talk about such an important topic. I think when we look back 2 years, and it's so hard to believe that it's been 2 years that we have quarantined and been at odds and reconvened with each other and things like that to come together. It's been 2 years of us getting through this pandemic, and that is almost unbelievable. But when you look back at the very beginning of the pandemic, we saw how clearly hard hit our African-American community was with the COVID virus, right? And so we led in cases as a Black community, we led in deaths as a Black community. And we can see that very clearly by the data when we look back on the LDH website. All of the data historically is there, as well as current data. But one of the things that we realized moving forward, especially as vaccines rolled out and our initiatives from LDH and all of our partnering organizations rolled out, is that the Black community also was the first to respond to vaccinations in a very clear manner. We went out to community organizations, created partnerships, grassroots efforts, faith-based communities and organizations, and we really hit the ground running to make sure that we address the needs of the community. I think one of the things that was said in even the previous panel is that we reached areas with funds that had never been touched before, in ways that had never been done before. And that was so important, right, for this particular work. We weren't looking to what our wonderful peer-reviewed journals and all of the best practices that were already out there. We went to the community and said, hey, what is it that you need? And then we have these funds and we'll give it to you in the way that you need it and do whatever you need to get the community out. And so we saw things like the Uber version of vaccines, right? And so not only having a mobile unit in a community, but we were to the point where people can call and say, I'm at, 123 Bonnet Street and I need you to come to me to give me a vaccine. And we had deployment crews to be able to do that. And so to see it at that that level, to see how we looked at health from a holistic perspective, using telehealth whenever we could, expanding Medicaid without having people dropping off because of, mail issues or anything else, or not getting information in. All of those things were ways that we addressed the community need in a manner that, was not allowed prior to COVID and the issues that were addressed by COVID. We saw the clear impact in the data. When you looked at the surges, when we started this, like I said, high cases of African-American deaths, African-American cases. By the time the surges came and vaccinations were out, it almost flipped. It clearly flipped. The cases for Blacks and deaths and cases, they reduced dramatically. You looked at the data, and there's one slide that one of our data analytics team shared with us, and it clearly is upside down. That in the first surge in 20, and then the surge in April of 21, there were very high cases. Even our population, there's a little gold line. If you look at it right now, it's on our LDH website. There's a little gold line that shows how many people in that particular region, area, or the state, whichever one you're looking at, says that's the amount of Blacks, whites, or otherwise in that area. And then the bar graph shows how many cases or deaths they had and how close it comes to that basically saturation line. Those flipped upside down. When it came to the August surge in 21, and then the other surge, the last surge that we had later in September or so of 21, Blacks we had gotten our vaccinations at a higher rate than where we show in the state. So we're about 32, 33% of the state population. We were accounting for about 40% of vaccinations by then. Right. So that means we were saturating vaccinations. And then you can see the same thing happened with our cases. It was the reverse. The cases went down to around 20-something percent, 27%, where white cases actually exceeded the saturation of cases and deaths and went up to about 67% of the population. They went almost up to 72, 73% of the population. And so what you're seeing is that as a community, Black folks came out and did what they needed to do for their health. They made the decision of health. They took leaders such as all of the panelists that I'm sharing the stage with today. And we said, we're listening to you. We'll take your advice and we'll do what we need to do to keep ourselves safe. The unfortunate part of that is that there's still disparities, right? And so we have underlying disparities and health disparities that we still have to address, because we're still part of deaths and things like that are still part of the problem. So we still need to address the health disparities that are now highlighted because of COVID, and really trying to work on that. And I think you'll see this panel, as well as the work that we've done with LDH, going out to other communities, working with LUCIL, which is Louisiana COVID Education Alliance, working to get the funds out in a way that's very strategic, working with our own Bring Back Louisiana campaign. They went out to the communities, they made partners at the ground level, and did not do this from a state perspective. And so I think those are the first steps, and you'll see that kind of continue to permeate through the years. Those are the first steps towards a holistic health. Thank you.
Yeah, thank you so much, Dr. Brown. We'd like to hear from Dr. Price-Haywood about her exciting partnership with Ochsner and Xavier University through the Institute for Health Equity and Research, which will offer a chance to look at health equity from multiple lenses. What can you tell us about the work that you're doing and what needs to be done to create a more solidified, comprehensive health infrastructure to support health equity?
Good morning, and thank you, Dr. Morial. I'm excited to be here with the panelists to speak about the work that we're doing with the Health Equity Institute. I'm incredibly humbled, to be quite honest, that I'm a part of this panel. So I want to share with you some work that we have been doing over the past year that I really feel, as the earlier panel had said, that this is a purpose. This is my purpose in life. And I hope that it's the purpose of all of us to work together towards one goal: improve the health of the state. I think it's been articulated very well that looking at LDH's stats, that we've had health disparities that have been well documented for a very, very long time. And the question is, what are we going to do to address it to be solution oriented? And so with that framework in mind, we came together, Ochsner Health and Xavier University of Louisiana, to function as a catalyst for improving equity. It was a natural partnership. We've worked with Xavier Ochsner has worked with Xavier for a long time. And obviously Xavier has the reputation of the highest rate of matriculation of African Americans into medical school, as well as raising African Americans up out of poverty. So it made sense for us to partner with them to co-lead, expand, and deepen our efforts around community wellness and health. Our mission is to improve the overall health of our communities, reduce health inequities, develop innovative delivery care models, and most importantly, develop models of care that are equitable and respectful. The framework that we use for doing this is what I call 5 pillars or 5 guiding principles. The first of which is outcomes research. My background is in research, and what we learned from COVID-19 was the importance of data, the importance of aligning research with public health and clinical practice. And so our goal is to identify disparities and develop effective strategies for improving health equity. The areas of focus over the past year or so that we launched our work officially in 2021. The work that we have done in research is focused on obesity, depression, anxiety, chronic pain, chronic opioid use, digital health solutions for chronic disease management to increase access to care, and of course, COVID-19. Our second pillar is population health management. So population health is a public health framework that focuses on driving better health outcomes and experiences at a lower cost of care. And our focus is on using data to drive insights into understanding social determinants of health, removing barriers, and making sure that we deliver models of care that will improve the overall health of the community. What we learned from COVID-19 was the power of data, the importance of standardizing data across institutions. And while we reported mainly along race, ethnicity, gender, age, and those sorts of categories, the other areas of marginalized populations that were important to keep in mind were people who don't speak English, who are immigrants, people who, different sexual orientations and gender identity, and where you live actually matters. So from a population health framework, the work that we're doing and trying to understand and developing models are keeping in mind that we have to have a data-driven approach to the work that we do, be it within the healthcare industry, in any other industry, or in the community. Our third pillar is health careers and equity education. And our goal is to focus on recruiting, educating, and retaining a diverse workforce in the state of Louisiana. We have a brain drain, and we have to optimize our population and employ them locally to help us move the dial. Our focus in 2021 with Xavier has been around developing new science degree programs. So we are launching a Master's of Science in Health Informatics, genetic counseling, among others. We also believe in the importance of embedding our students within the healthcare system and other industries very early so that they can see the opportunities of career paths that they can take. And in that regard, we are co-hosting paid internships in the areas of research, population health, and healthcare administration. We've also worked with Delgado Community College, as well as Kingsley House and some others around developing a community health worker apprenticeship program, which includes people who participate in that program getting a certificate as a medical assistant. If you come into an organization with a medical assistant certification at Ochsner, we have a career path where you can go from an MA to an RN, and the impact that that has on the community with upward mobility within the organization, and obviously salary increases that go along with that, has a direct impact on the community. And finally, we realize we have to focus internally on ourselves. And so we've launched implicit bias training, not just for providers, but for the front desk staff. Our fourth pillar is community engagement. And we all know the saying, nothing about us without us. we cannot develop solutions if we don't develop coalitions and partner with people across different industries. It does not, the healthcare system is not the solution to everything. In fact, most of what impacts health is upstream of the health system. And so as we worked through 2021, of course, we had a big focus on COVID-19 equitable vaccination. And the key there was to have a data-driven approach where we targeted neighborhoods where we know that there are high areas of deprivation, partnered with community organizations within those areas to host events, to also do outreach and education around COVID-19 and then vaccination and other health issues. Our fifth pillar and final pillar focuses on health advocacy and policy work. And there are 5 big areas that we have decided to focus on because of what we know are the top drivers of health inequities and health disparities in the state of Louisiana. So tobacco obviously has a big impact across everything you can think of in terms of chronic disease and various outcomes. Maternal health. I mean, this state is labeled as one place where it's the worst place to deliver a child. So we do need to address this systematically. Education, everything starts from K through 12 up through college. We have to focus on opportunities there. Digital access, we saw that with COVID-19. Who was able to socially distance versus not? Who had difficulty with education? Who was left behind as a result of not having digital access? And then finally, job opportunities. And that's across all industries, not just within the healthcare system or within the educational system. So I say all that to say and end with, we developed this approach because, as was mentioned earlier, after Hurricane Katrina, we were having the same conversation. It's 17 years later. We expand healthcare systems and clinics. We expanded Medicaid. But yet, when COVID-19 hit, those folks who had already had been set up to have poor outcomes were the ones who were the first affected by COVID-19. It's time for us to be solution-oriented and to build coalitions across industries to work towards improving the health of our state. Thank you.
Yeah, thank you so much, Eboni. That's a very, very comprehensive wish list. And I think we've got a group of people here who are very passionate about making a difference in many of the pillars that you presented to us today. We're excited also to have Dr. Eric Griggs, and we'd like him to comment. What can we do to create the health infrastructure that's going to support health equity in Louisiana and move the needle to positive outcomes? Dr. Griggs.
So first of all, I'd like to say thank you, Dr. Morial, for having me here. I'm very familiar with most of the people on this panel and honored to be here with you as well. It's been a fight and a struggle, and I'm not just talking about the last 2 years. The last 2 years have literally been, it's nothing like I'd ever dreamed of in my life, especially in my professional career. But there's some good things that came out of it. If you listen to the presentation by Dr. Price-Haywood, it sounds like, and it's the truth, we built it. We did it. COVID-19 forced all of us. I worked with LDH. I worked with the partners on this panel before, Xavier, you name it, I've done it, but we've never worked this closely together before. If any other time in my career that I can think that we've worked together as a family, I won't be able to think of one, because we talked almost every day with one person that represents someone on this panel with regards to our community. It actually all started with Governor Edwards being the first one that's brave enough to say that 7 out of 10 bodies showing up in the morgue due to COVID looked like me, looked like you, looked like us on this panel. And it couldn't have come at a better time. The sustainability of the infrastructure is what seems to be more important. Over the course of the last 2 years, not only have we empowered specifically our Black and Brown communities about COVID, we've really caused them to take a look at themselves with regards to all of health. I have never, from the ground up, I tell my students that community medicine is people, practice, and policy, and you have to spend 100% of your time in all three of them in order to be effective. I think this is the first time in my career that I felt that the community, our community has felt as respected, because not only as experts and officials did we go to them with surveys and questions, we stayed to get their feedback and ask their opinion on how can we do this better, rather than staying in the ivory towers and having them come to us. Every effort has been made to go meet them where they are respectfully in their house and stay long enough for us to feel the rain that falls on their head and be reminded that it falls on ours too. So again, if you listen to the comprehensive presentation, the beautiful comprehensive presentation that was put forth right before I came on, and then by the future Dr. Brown, you'll see that I think conversations like this, the plan for the infrastructure is there, but COVID-19, in light of the travesty of unfortunate events that have happened in these last 2 years that have put the things that we've been kicking and screaming about for decades, I want to say centuries, to the forefront, that if you don't want to talk about equity right now, you're doing that as a personal choice. And it's good because we need to know that so we can move around you. What needs to happen is we need to continue this effort moving forward. We know that the numbers are down right now for COVID, and people feel like, it's going away and that we're okay. But 1,500 people in our country died yesterday from COVID-19. The last 7 days, it's been 1,000 people a day. If you look at what's happening in Europe and in China, as we know, if we pay attention to the patterns, our patterns, not our long history, but our recent history of 1 year ago, we made this same mistake. So in about 3 to 6 weeks, we're going to see that subvariant is going to be here, and we're going to have to prepare for another surge. I say that to say we need to take the same infrastructure, continue those conversations. All of the community members, keep engaging them. All of the programs, continue to engage them, but not just around COVID, around all of the things that have plagued our community. I'm from five generations of diabetics. We have obesity as a plague in my family. We have hypertension in my family, and it's been a running joke for generations until now. I've never, you want to talk about where we started and where we've come in the last 2 years. Never in my life have I had so many conversations about the R naught, or the difference between a messenger RNA and an mRNA virus, an RNA virus and a DNA virus. It's having conversations with our community in a respectful manner. I can't tell you how refreshing it was to be like, wait, hold on, doc, you just found out about this too? I'm like, yeah, so let's learn together. Our community, we've raised the confidence of our communities. And what does that do for us? What it does is it empowers them when they're in the doctor's office, in that clinical visit, to ask those hard questions and hold their healthcare providers and their health policymakers accountable. No, that's not right. My hemoglobin A1C has gone up 4 points since the last time I saw you, and something needs to be done about it. What in my diet needs to be changed? We take the same approach that we've taken with COVID, and we apply it to all of the other social determinants of health, and of course our health issues. We use this to magnify our voice and continue to have those conversations, and we'll be able to sustain the infrastructure that has been beautifully created and being ever created, but beautifully created. I mean, your community health workers become medical assistants. I have my own sister who does not have a high school, she got her high school diploma because she was like, wow, I didn't realize I could do this. I've been fighting all this time. She said, I've been trying, but Eric, I didn't think you listened to me. This is the first time you told me you don't know. That's my fault, because I go off and I get schooled and I feel like I can't talk to my community. We took the time to intentionally talk to us about issues that affected us, and it was COVID, and will continue to be COVID, that does it for a while. But I think if we continue to empower our community to talk about these other health inequities, because, especially in Louisiana, we don't mind speaking our mind when we know we're right. Am I right?
You're right.
Yeah, as we continue to do this and to continue these conversations, I think that the future will be bright no matter what we face.
Yeah, thank you so much, Eric. We're all excited and inspired by Dr. Brown, Dr. Price-Haywood, and your words, Dr. Griggs. We just got to keep our foot on the accelerator to be respectful. We've raised the awareness, the confidence, and the ability to empower ourselves. But we've got to keep the foot on the accelerator so that we can have policy change, because we know that's the ultimate win for all of our people across, the diverse populations that we are serving. So we'd like to hear from Dr. Stewart from the Louisiana Center for Health Equity. We know you do a lot of work around policy and health equity, policies that linchpin for the infrastructure. What are the policy solutions that we can use to move the needle for positive outcomes across health equity?
Thank you so much, Dr. Morial, for that question. And greetings to my colleagues on this panel, my esteemed colleagues. I'm very happy to be on this panel with all of you. Let me just start by saying, as Davondra did, I get the title doctor by, I guess, honorary privilege. I am a registered nurse. I am also a career employee, retired employee from the Louisiana Department of Health of 27 years, and also working in the community in advocacy in multiple ways to help advance health and health outcomes in Louisiana. And so just to let you know, my name is also Alma Stewart Allen, recently married. So thank you so much for this opportunity. Louisiana Center for Health Equity is a organization, a nonprofit organization, nonpartisan organization that has been around for 12 years. And just as our name says, we have been advocating for addressing health disparities through the lens of equity, health equity over these years. Our sole purpose is to improve the health outcomes and access to health care through the lens of equity, as I've said. Our most significant accomplishment over these 12 years has been our advocacy work for Medicaid expansion in the state of Louisiana, which we're very pleased and proud that we still hold the distinction of being the only state in the Deep South that has expanded Medicaid. The result of that, the impact of expanding Medicaid has been major. It has been significant even prior to COVID-19, but especially during these 2 years of COVID-19. Individuals have been able to access health care, have health insurance coverage through Medicaid, and to remain on their health insurance coverage regardless of income during these 2 years. We also have benefited by the fact that our provider community, our hospitals, are also able to be more economically sustainable and stable because of Medicaid expansion in the state of Louisiana. So I just wanted to give that little bit of background about the office, the Louisiana Center for Health Equity. I also want to talk about our LA 40, the LA 40 by 2030, which is the bold vision of the Louisiana Center for Health Equity that was conceived in 2019 and announced at our Health Summit in 2020. 2 years ago, we announced that in March at the Health Summit, which is a collaboration that we do with the Louisiana Department of Health and the Office of Public Health, as well as the Penton Biomedical Center, the Office of the Governor, and many other partners that collaborate, that announced and rolled out the LA 40 by 2030 vision, which is to improve our health outcomes and the quality of life for Louisiana children and families over this decade. And our goal is that Louisiana will be ranked at least 40th by the year 2030. I believe that we're well on our way. It has been, the LA 40 by 2030 has been so well received and embraced that we have corporations, major corporations such as Ochsner, that have come along with efforts and initiatives to help to further that goal. We also are working on policy initiatives. I was asked to speak more specifically about policy. The LA 40 by 2030, through the framework and lens that we have created created it is a policy. And that policy is moving forward. We are implementing LA 40 by 2030 through various strategies. Just recently, we held our 7th annual Health Summit, which the theme was Pathways Through Policy for an Equitable Recovery. We know that if we are truly going to move Louisiana forward and we are going to improve our health outcomes, it will happen because of policy, through policy. We also know that we have data that we have access to a lot of data, and that, as my colleagues have said prior to me, data is significant, and having a data-driven approach is imperative. We can, especially if we are going to implement an equity strategy, we cannot do that without utilizing the data that we have, and in some instances, getting additional data and data sets that we don't have. We saw that with COVID-19 as an example. Initially, we had anecdotal data about where the deaths were occurring. And then there were requests of the governor to provide data by demographics of the impact of COVID-19. And that data did verify that we were in fact experiencing disproportionate impact in Black and Brown communities of the COVID-19. Thus, resources were able to be tailored to and deployed to those communities that were hardest hit by COVID-19. That's a success story. And I applaud the administration, the governor's office, and the health department for taking advantage of the information, the data that we have to respond, to create and develop a response, an effective response that has been impactful. I'm right now working, we are working as a group in terms of the partners to focus our energies around the equitable recovery in a similar fashion. We know right now that Louisiana has a $2.8 billion surplus. And we also know where the greatest needs are. We know the communities that have been most impacted by COVID-19, and we know that those resources should be deployed to stabilize those communities and to assist those communities in becoming more resilient, so that in the event, or not in the event, we know that we're going to have more disasters. We know that they're going to come. That's part of where we live. We need to make sure that those communities are benefiting from this huge infusion of resources, so that they are more resilient for future disasters. And we're working towards that. In terms of our policy with regards to the LA 40 by 2030, when we announced the LA 40 by 2030, we also came up with several recommendations in addition to the LA 40 by 2030. We also came up with it and put forth a recommendation to address the issues around women and women's health. We know that women are the majority population. We also know that in terms of health outcomes, we are 50th. And when we stratify that based upon data, we know that Black women tend to be, have poorer outcomes than our white counterparts. So we know that we have to have an equity strategy. We know that women have to be a priority population. We are advocating for an office on women's health. There are 2 bills currently right now in this legislative session to establish and create that office. We know that the birth outcomes, maternal mortality, infant mortality, premature births have a significant fiscal impact or financial impact on the state. And if we alone can improve in those areas, we could save the state millions and millions of dollars just on having better birth outcomes, not to mention the improved quality of life for those mothers and babies and families. Also, the second is a state minimum wage. We know that Louisiana is a poor state. We are among the poorest states in the country. We have, the last data I looked at, I think it's 46%, more than 40% of Black children currently live in poverty in Louisiana. And that has worsened since COVID-19. Many of our outcomes, our key performance measures have worsened over these 2 years of the COVID-19 pandemic. So we know that we have to address economic stability, family economic stability. We need to pay people a living wage, a livable wage. We know that Louisiana is among one of 7 states that does not have a state minimum wage. There is also legislation. I've seen at least a couple of bills that would put in place a minimum wage, a state minimum wage in Louisiana. I encourage everybody to really get behind some of these policies and support and advocate for policies that help lift families out of poverty. No one can live on $7.25 an hour, which is our federal minimum wage. No one can live on $7.25 in this day and age, and especially when everything is going up, including food. So food insecurity is another issue, an area where we are seeing significant concerns and issues that need to be addressed. So a state minimum wage, we need a livable wage that helps people. We also need to focus on economic mobility and stability and sustainability for those who are most disadvantaged. In this case, we know that that's African-American men who are at the lowest of the totem pole when it comes to economics and finances and income. We need to create and develop pathways for them to have skills to be more economically sustainable. And we are working actually right now with with the UL system to create more opportunities specifically for Black males in response to that. The other point that I want to touch upon is the trauma and adverse childhood experiences. We are also advocating for policy in that area. We're pleased to see that the John Bell Evans administration, particularly the First Lady, has taken that on as an issue, and that there are efforts to move forward with creating a more systematic approach to addressing trauma and ACEs. We know that our young people, our students, which is a major focus of our organization as well, have been traumatized, not just over these 2 years of COVID, but especially over these 2 years of COVID with distance learning, social isolation, the impact of, in terms of the life toll on our communities of color, with the deaths and the sickness and all of that came along with COVID. We have a mental health crisis among our youth. And we are working to address that mental health crisis by providing more trauma-informed services and programs, especially in the school system, and also screening and resources, interventions appropriate for addressing adverse childhood experiences. We know that the long-term impact of doing so is tremendous. And we also know that if we don't do it, there is a price to pay. And that price to pay will go into a lifelong challenges that those youth will have as they become adults. So kind of to wrap up, I've already talked a little bit about the LA 40 by 2030, which is the 4th policy lever that we are advocating for at this time to move Louisiana toward the LA 40 by 2030 in terms of being a healthier state and improving the quality of life for our citizens, which is what it's really all about. But I cannot have this talk without really talking about collaboration. Collaboration is really key. We didn't accomplish any of the work. We have not accomplished anything that we have set out to do, including Medicaid expansion, without collaboration. We will not get the Office on Women's Health without collaboration, which we have a significant collaborative focus right now through the campaign to establish the Louisiana Office on Women's Health. Collaboration is key. We have such an opportunity really to harmonize in the efforts that we are working on. I am so encouraged by all of the work that all of my colleagues and the other department, state agencies, the other provider organizations and corporations. I am so encouraged by the work that is going forward. I think that we have such a tremendous opportunity to further harmonize our efforts in such a way that we can leverage all of the great resources that this state has, the great assets that we have to increase the impact towards the outcome, the shared goal and outcome that we have to be a healthier state, and that our citizens, the people of Louisiana, are actually healthier. So really just want to stress that note, and to kind of end on that note, that collaboration is really critical. We know that every stakeholder has a part to play. We know that research is vitally important, and we need to utilize the research, to inform the practice, both policy and practice. And we're working to build a collaboration in that area. We know that legislators can see what benchmarking data looks like and better communicating, and they can better communicate with their constituents and be more responsive to their constituents. We know that community organizations can find ways to collaborate and identify effective programs. We also know that voters play a key and critical role in what we are doing. We know that voter engagement is important, and everyone has a civic responsibility. We have research and data that show that low voter turnout also contributes to poor health outcomes. And so it's important that we encourage and we engage all communities, all of the sectors of the community and demographics in this democratic process to exercise their right to vote, so that we have elected officials and policymakers who do in fact represent the population and the people who send them to the legislature and to the governor's mansion. We also need to be civically engaged and to hold them accountable for representing the people who elect them. We also know that hospitals and insurers, we have better data, and that better data can be used to help engage, to help inform community engagement, community outreach efforts. So my point of saying all of that is to say that working together in harmony really benefits us all. It helps to move Louisiana in the direction that we're trying to get, and that is the LA 40 by 2030, and improving our health outcomes and ultimately the quality of life for all Louisiana citizens.
Yeah, thank you so much, Dr. Stewart. We appreciate your comments. We're going to move on. We know that the Urban League of Louisiana and the Legislative Black Caucus recently engaged in statewide listening tours this past summer. And one thing that came across loud and clear from our Louisiana residents was thinking about health holistically. Residents talked a lot about nutrition, food access, and mental health. We also know that in the state of Louisiana, the rates of food insecurity are some of the highest in the nation, especially for children. So I'm asking the panel, what does it look like to invest in any of these entities, and how would you see us approaching the issues of nutrition, food insecurity, and mental health?
I'll start. And I'll address the mental health piece, since that's something that's really near and dear to me as a primary care physician. In the state of Louisiana, actually, mental health or report of stress is one of the top 10 drivers of our ranking as being number 50. And in a survey that asked adults who, to report on their mental health as not being good in 14 or more days in the past 30 days, in Louisiana, the response was 18% compared to 13% nationally. And then that data was further broken down, looking at disparities by disabilities and poor physical health, employment status, age groups, LGBTQ+, income status, marital status, and veterans. And there were groups along those different dimensions who were more likely to report having poor mental health. So in terms of addressing it within the state of Louisiana, I think all of us will agree that we've suffered from having low resources in terms of providers. And I would have to also add to that insurance coverage for certain types of services. It's incredibly challenging. So in terms of evidence-based interventions, it's been shown that if you have group or community level education on strategies to reduce harm and awareness of resources is something that we really do have to focus on, and sharing that knowledge and spreading the information. Even though we may not have the resources at the level that we desire, they exist. And we have to focus on helping people navigate through that. We also must increase the rate at which we are screening both kids and adults. Okay. And anything not spoken doesn't exist. And that's what we tell ourselves, but that's not the case. We have to be proactive. And culturally, a lot of us don't like to talk about mental distress for whatever reason. But if you approach it and you make it a normal conversation and it's a part of your health, then it becomes something that gets integrated into how we deliver care. The other piece is we need to really proactively start developing data dashboards, looking at mental health issues, whichever domains that we as a state feel that we need to follow. But again, the data is what drives insight. And also, as we just spoke of, how that information can be very influential into health policy, as well as influencing decision-making that may, for example, expand insurance coverage. Last but not least, there are need to support policy as it relates to certain types of care models. So intensive outpatient treatment, for example, for substance abuse, group therapy as opposed to insisting on one-on-one types of therapy sessions. And finally, something called the collaborative care model, where you have embedded within primary care behavioral health services, which could be in the form of a licensed clinical social worker providing cognitive behavioral therapy with consultation with psychiatry for difficult, complex, severe mental illness and questions about medications and things of that nature. All that I just mentioned is not covered by your insurance. We have to go through incredibly difficult processes of trying to access services for patients. And depending on your insurance coverage, it makes a difference. And if you come from a low income background, you don't have the ability to pay out of pocket, and your insurance plan is what it is because of your employer or whatever else, you're stuck. And so you don't have access to service. But I think we need to be more proactive about talking about it, educating about it, screening for it, and covering it so that people can access the appropriate services.
That definitely was a great answer, Dr. Eboni. And I think I'd just like to add just shortly to this is that the Louisiana Department of Health has put out, under the direction of Dr. Phillips, our LDH business plan. And you see at the forefront of that business plan, our first commitment is a commitment to addressing Louisiana's health and well-being in a space of prevention. And I think exactly what you just stated is that we have to kind of get ahead of things. One of the things that we're also doing is we're working on a collaborative that's coming out later this fall with the Louisiana Department of Education and the Department of Children and Family Services around parents as leaders. And I bring that up because one of the Parents as Leaders programs that's already established in New Orleans, that's outside of the state collaborative, but there's one that's in New Orleans. I had the privilege of sitting into those parents' proposals on their projects, because they do projects that are dear to their heart. And one project honestly answered this whole entire question. She's going to create a wellness garden where people come in, the community comes in to plant, to talk about plants and how nourishment comes from the ground and the earth and how we can build our own plates and our own tables, but then use that as well as a meditation space to promote mental health and wellness. And so having those very collaborative approaches that are indoctrinated in the community, I think is one of the things that we're going to see flourish across the state. When we listen to the community and what answers they have to these problems, and we honestly start funding those types of initiatives, that's when we'll see a big, stronger push and a stronger movement in our mental health disparity issues.
I would like to add to what has been said. Also, one of the things that stands out for me and for my organization is the need to address the systemic and structural barriers, and to do so through the lens of the determinants of health. We know that politics play a major role in the outcomes that we have, the conditions that are created and perpetuated in communities of color, in rural communities and other disadvantaged communities. So we have to really focus on why do we have these problems, such as, food access? Why is it difficult for people in North Baton Rouge to get access to healthy foods? So those are things at the structural and systemic level that we can address through policy and also through practice. But it starts with looking at what the data is telling us, where the resources are needed, and also how those resources need to be provided in terms of access so that they truly are accessible and affordable for the individuals that are most impacted. The determinants of health are really, really critical. And as we think about an equitable recovery, which is a key focus right now, as we think about where and how to allocate resources into these communities to improve these areas and sustain these communities, it is very, very important that we really, really think about what is it that we are doing on a systems level and a structural level, and how can we recreate those areas so that we have communities that are thriving. We have communities that are not left behind, even during this time. So I'm really stressing this point because we have resources right now, and we have the opportunity to get it right. We have the opportunity not to repeat what happened after Hurricane Katrina in 2005, where all those resources came in, but the communities that were most impacted largely did not really benefit in terms of being more resilient during that recovery period. So I'm stressing to us that we really look at and think about not just our intentions, but what is the impact? I stole that from one of my colleagues. Intention and impact are really two different things. We have great intentions and a lot of resources that are deployed, but are we getting the impact that is necessary for an equitable recovery?
So really just.
Yeah.
Just to add
Thanks,
in
Dr.
there-
Stewart. I'm just wondering if Dr. Griggs has any thoughts about these topics.
Yeah, I do really quickly. I know we're running short on
Yeah.
time. All of this is great. And like I said, with my students, I mean, we are doing the work. The issue is it's the people. We have to take into account the people that we're trying to serve, particularly when it comes to health literacy. If you talk about a food desert, go prior to COVID, we were working in a community center, and the people in the neighborhood, man, ain't no desert over here. We got grass, we got trees. We don't have no problem with food, even though they don't know that they're unhealthy foods. We have to, the CDC has plain language dictionaries, and they have languages and health literacy. We need to use that. But to be quite honest, all of us on this panel, we know how to talk to our cousin. We know how to talk to our best friend. We know how to talk to people that aren't in policy. So being that voice in the room when people are putting together the programs, be like, okay, I know you want to present it like this. Your social determinants of health. When you're talking to cousin Nook, say community. Oh, why didn't you say that? Food desert. You have food, but it's not healthy for you. So including the community with the beautiful programs, like I said, I keep using the word beautiful because it's great to hear these programs with the Ochsner Xavier Health Institute for Health Equity, that program with the MA, empowering them, letting them know that we're saying the exact same thing. Here's another word for it, and help us. It's all about, like I was about to call a Reverend Dr. Alma Stewart said, we all need to work in harmony at all levels with respect, from the lowest, that least, that didn't go learn the big words and acronyms that we learned, letting them teach us how to make this work, and so we can all work together.
Dr. Griggs, my husband is the Reverend.
There it is, there it is. Want me to do it?
There you go. Yeah, thanks everyone. And some food for thought. Some other states have established what's called a statewide equity fund. I'd like to hear from each of our panelists. If we were to institute some kind of statewide equity fund, what would be the priorities? What can we think about in terms of sustainability and empowerment of our communities? If you were given a wish list, what would your focus be on if we did have a statewide equity fund?
So I'd like to jump in on that one first. So one of the things that our office is working on at the state is to identify what health equity plans we have across the state. New Orleans, we know, is one of the few cities that actually has a health equity plan. The Louisiana Department of Health had its first health equity plan, thanks to my predecessor, Dr. Nusia's Benjamin Robinson. And so we'd like to see across the state who else has one, and how can we assist them in creating one? Not only the creation of one, but then the implementation of them. How can the state, the Department of Health help them to execute those health equity plans in a collaborative, systemic, and strategic manner where we are working together for common goals? That's the way we're going to move health outcomes. That's the way we're going to address people where they are and what they need. We can't serve New Orleans the same way we serve Shreveport and Bastrop, Louisiana. We have got to be able to serve people the way that they need it and in the manner in which they have asked for it. One of the things that I love that Dr. Griggs has said is that we need to speak plain language, but I can't speak my New Orleans dialect to my folks up there in Northeast Louisiana. They're going to tell me, go back down south and go on about your business. I don't want to see that. I know Dr. Phillips doesn't want to see that. We serve the entire state, and we want to make sure that we're doing it the way that everyone deserves. And I think that's one of the main ways we can do it, is just to make sure that we're addressing people where they are and what they need.
Yeah, thank you so much, Dr. Brown. Dr. Price-Haywood, Dr. Griggs, any other thoughts about that particular question? A statewide health equity fund?
I mean, as can be expected, I can only reinforce and agree with everything that was just previously said. It takes work to individualize based on the community what's needed. You know, a lot of times we have data for days on everything. We know what each community needs, but it's more what they want. If I'm sweating and I look like I need some water, but I'm hungry, I'm like, I'll take an apple. Until you offer me what I asked for first, I'm not going to accept what it is that you know that I need. And we've experienced that for how many years? So listening to each individual community, not trying to go up to Shreveport and offer crawfish, because they'll say they might say it's bait, like we're going fishing. Not a one size fits all solution while we all work together at all levels, just enforcing our plan. I think that would be my magic wand.
Yeah, thanks, Dr. Griggs. Dr. Eboni?
Well, it's hard to follow. I don't have any additional comments because I think everyone has said repeatedly that the solution is in the community, and give the community a voice and learn to listen. And it is important for us not to think that we're the experts in everything and coming into someone's neighborhood and telling them what they need to do. The most powerful thing that we can do is to go in and just listen to what they have to say, listen to the solutions that they have, because if you don't do that, nothing that you do will be seen as feasible, reasonable, or sustainable. So it has to come from them. I don't have any additional comments, but it's all about the community. It's all about their voice, and it's just stop and listen. And let's not tell people what to do, but work with them to figure out what should happen.
Well, I think we're out of time. I just want to thank everybody for your participation, and the Louisiana Urban League. And the Louisiana Urban League has been very skillful in offering listening sessions all over the state so that we can meet you know, our citizens where they are to provide the services that they want. So thanks everyone for your participation today.
Thank you
Have a
for
good
answering, Dr.
afternoon.
Moria.
Thank you.
Thank you.
Thank you.